Okay, I've got my supplies. I'm coming in. Knock, knock, knock. Hi, Mr. Smith. I'm Alex. I'm your nurse today. And I'm going to be doing a dressing change for your central line and doing a blood draw so that we can give labs some blood for tests that we're doing, which your doctor would like. Okay? Can you tell me your name and date of birth? Great. And can you tell me if you have any allergies?
No.
Drug allergies,
Nope.
allergies to adhesives or latex at all?
Nope.
No? Okay, great. I'm going to go over and do hand hygiene. I'm going to wipe down my surface here. Let's see, let's bring this over here. Good. I'm going to do hand hygiene here. Great. And what I'm going to do, I'm going to open, no, I'm going to do this first.
Clean gloves.
Yeah, okay. So hand hygiene, going to get on my clean gloves. Got my clean gloves. So we're coming over here. I've given you your mask. I've got my mask on. Let me make sure not to contaminate the area. And see if you can keep your head over this way just a little bit. For me, okay? All right. So I'm just going to come over here and I'm going to assess the area. I'm noticing that there's no redness or swelling. It looks like there's no drainage. I don't see, it looks like the measurement is the same for the catheter that's sticking out. And I'm going to come in here. So I'm going to go ahead and open. Broken looking. Great. Okay, so I'm going to go ahead and stabilize this from the center and pull the dressing from distal to proximal. Just making sure you're doing okay. I know sometimes this tugs a little bit.
Yeah, I'm fine.
Yeah, okay.
Luckily, we shaved before
Oh, good.
the hospital.
Yeah, okay. All right, so I'm just going to pull this around. Great. And
Instruction is already on.
go ahead and let's see.
Yeah, keep that.
Move the oxygen so I can access the
Doo-ba-doo.
Remove my gloves.
I can touch you.
Yeah, you can
because
touch.
I am clean, but not
what-
sterile yet.
Yeah,
Okay, so we've taken this off.
because you put on clean gloves. Yeah.
Right, clean gloves. So we've got this. I'm going to go ahead and take the biodisc. We're going to throw that away before we put it in there. All right, so this is open. I did my assessment. I'm going to go ahead and do take off the clean gloves, do hand hygiene. I'm going to come over here. I am going to open up this. Let's see. Be careful of that. All right. And I'm going to come around. Here, touching the outer 1-inch edge. And I'm putting the shiny side down. And there is a sterile field. And I'm going to go ahead and take my gloves. And I'm going to come on over here. And go ahead and open up my gloves, being careful not to turn my back. I'm going to pull the cuff over inside the cuff. Great, so I'm now sterile. I'm going to go ahead and come back over here, looking at that area. So I'm sterile, I can touch in here. I've got that. I've got my biodisc. Oh, I've got one there.
Oh, you got one. Okay, sorry.
Yes,
I thought it was
do.
empty.
Nope, I opened it up and
Got
put it
it.
in there. Great. So I've got my sterile gloves on. I am going to grab with my there we go. All right. So with my non-dominant hand, I'm going to take these pincers, and I'm going to go ahead and grab the chlorhexidine scrub. I'm going to go ahead and lift the central line. I'm going to break this. I am going to go ahead and scrub back and forth for 30 seconds. Scrubby, scrubby, scrubby. Scrubby, scrubby, scrubby. Scrubby, scrubby, scrubby. Scrubby, scrubby. I'm gonna use it to scrub on the on the actual line itself, making sure to get behind there. I'm going to go ahead and get in there as much as I can with these. Okay, there. I'm going to just throw that right there because it's done. If I need to, I've got extra Q-tip swabs. Being careful not to break my sterile field. And then I'm going to go ahead and come in here with a biodisc. I'm going to go ahead and put the biodisc in place with my sterile hand. Oops. And then, oops, I can go ahead and let that go. We're good with that. Coming over here. Great. So now no longer sterile. I'm going to go ahead and take our dressing. And I'm going to go ahead and, using my finger on the inside, start at the center and push out, making sure that there's no bubbles, making sure that that's on nicely. All right, now the area is no longer needing sterility because we have a dressing over the top of it. I'm going to go ahead and take that off. I have a thing right here, and I'm going to write my initials and the date of the change, and I'm going to slap that on there. Again, we don't need the sterile field anymore because the dressing is covered. If I need to at this point, I would go ahead and change the caps, making sure to scrub the ends with cleanser, putting on new Curos caps, and making sure that everything is clamped, unless they're the positive pressure clamps or ends, in which case I wouldn't need to.
Okay.
So that's all done. Hands are fine to just go ahead and kind of just take everything here and throw all this away. So I'm going to throw that away. I'm going to go ahead and do hand hygiene. All right. And I'm going to go ahead and wipe this down one more time. I'm going to go ahead and put on some clean gloves. And we're going to go ahead and access your central line to get some blood. So I've got over here my my tubes for the blood draw. I've got my blood collection adapter. I've got some biohazard bags. I've got some saline flushes. And okay, so here we are. I'll probably just go ahead and do hand hygiene again. Put on some clean gloves. Make sure that this is unclamped. And we're gonna take off.
Wait, don't you have it clamped before you take it off?
Yes.
Clamp. Yeah.
Clamp. Open that up. I'm gonna throw this away. This is a brand new one. I'm going to scrub. All right.
30 seconds to dry.
30 seconds to dry. And then I'm going to come over here. I've got my saline solution. All right. And I'm making sure not to tug on the line. I get any air out of there. Okay. And I'm going to go ahead and flush the line. Took off the top. It's a sterile top, so I don't need to clean it. So I'm going to flush the line using a 10 milliliter syringe because anything smaller would be too much pressure. So I'm going to flush the line using a pulsatile pressure. And then I'm going to use that same thing to take up, to bring in blood waste. So I would draw back up 10 milliliters of blood waste.
Yes.
I'm going to go ahead and take this off, put this to the side here. I'm going to go ahead and maybe I've opened that ahead of time so it's ready for me. So I haven't touched this end. This end is still clean from fat. So I'm going to go ahead and put on that. I'm going to drop this because I don't need it. I've got a waste container here. I'm going to fill that up with waste blood, put it aside. And then I'm going to go ahead and fill up the container that I have, making sure it goes all the way up to the line that is needed.
Good job.
I'm going to go ahead and put that to the side. I'm going to undo that, throw that away. And then I'm going to take a new flush and open up the top, get all the air out, and then we're going to go ahead and do one more flush. Before I've started all of this, I would have needed to stop any pumps that were going and waited for a full minute or 2 minutes before I actually went ahead and did the and did all the things.
Good catch.
So we're here, we're doing the second flush after we've drawn blood. Again, pulsatile pressure going through. I'm gonna go ahead and, oops, and I would have undone that earlier when I was doing the pulling.
Yeah.
Okay, now it's closed. I'm gonna throw that away, and we're gonna put a brand new Kuros cap on. And again, if I needed to, I would change this, but that would have happened during a dressing. So we do that. I'm going to go ahead and we've got the labels and the biohazard bags. So on the labels, I'm going to go ahead and put my initials, the date, and the time of the draw. And I would put that on the one that's going down to the lab. The others are going to go into the biohazard container in the room. The blood waste here. I'd go ahead and put those in here. This one is labeled. I put the rest of the labels in there, and then I'd go ahead and put them aside to send down to the lab. I'd go ahead and let's see, make sure. Oh, this wouldn't have to be classed because I'm starting up an infusion again. So the infusion gets going again. These are in the biohazard. I'm going to clean up all of my stuff.
Okay.
I'm going to go ahead and throw everything away. Make sure, do hand hygiene, take off gloves, do hand hygiene. Make sure that you have everything that you need. You don't need to wear the mask anymore. We can go ahead and let that go. And make sure that your bed is low and locked. Make sure that you have your call light, that there's privacy, that you use the bathroom if you need to, and that the pump is running as it should be. And make sure that you're not having any pain. And then go ahead and answer any questions, but that's it. We're all done for this, and let me know if you need anything. And I'll toss this, and we're good to go.
Good job.